Good morning. Good morning. Good morning. Hello, everyone. Welcome to the Nursing School Show. I am Matthew.
Christina.
We are here to talk
nursing
school specifically.
Nurse,
not a nurse. We are here to help you
nurse,
get
not a nurse.
nurse, not a nurse. We are here to help
That's
you get
awesome.
through nursing school. Welcome. Thank you for joining. We are doing another Ask Me Anything. We've had so many questions popping in that we're going to answer them.
We're just
along with
keep
other
rolling
answers,
with this.
other questions, what have you. Go ahead and pop down into the comments and ask your questions about nursing school, your thoughts, your struggles,
Your feelings.
We will
Let us
talk
know.
about them. We are
Let
here
us
to
know.
help.
Yep.
We have some questions from last time that we weren't able to get through, so I have those. But go ahead and pop in more questions, and we will answer them as we go.
Hey, Charlotte. Good morning.
Good morning. Good morning. Good morning. I don't know the song.
The sun is out this morning.
There you go.
We used to sing that to patients.
Mm.
Good morning to you.
And you.
And you.
How
All
are you
right.
guys on this
Let's
fabulous
do
Wednesday?
it. Okay, we have received some questions about finals. Now, finals, I'm going to do a deep dive into finals next week. So stay tuned for that. We're going to have a Ask Me Anything finals topic day next week. There you go.
All right. So yes, there are a couple questions that came last time for finals. We will be talking about that in depth.
Yep, absolutely.
On the week after this
next week.
Which would be next week.
Monday or Wednesday. I'm not sure which one.
So we do our lives every Monday and Wednesday at 9 Pacific.
Yep. We're here.
12 Eastern, et cetera, et cetera, et cetera. Go ahead and hit the subscribe if you're on YouTube. Follow us, hit the bell, all those good things, and you will be notified when we go live.
Boom.
All right. One question that has come up and we should dive into. Are you ready?
I'm so ready.
All right. How do you use the Merck manual? I do not know what the Merck manual is, but how do you use it?
The Merck manual. Who has the Merck manual? Raise your hand. Raise your hand. Get your hands up. Throw your hands up. Throw your hands up. If you have the Merck manual. The Merck manual is a deep dive into medical disorders. That's kind of how I think about it. So here is the two kinds of textbooks that you are going to want to have in nursing school. First one, high level. You want a high level overview of things. And my favorite high level overview textbook is the Made Incredibly Easy series. So this one's fluid electrolytes. Let's just get all of our textbooks out, shall we? This is the nursing assessment, pathophysiology. I'm sure I have more upstairs. This series is so good, friends. So if you are struggling with just generally understanding what is happening in nursing school, this is the first step. This is where you're going to want to start if you wanted to do it out of a textbook. So two kinds of textbooks you should have in nursing school. High level overview. So this just explains very simply, very easily the topics for nursing school. Now, the second resource that you're going to want to have is a more deeper level explanations. And that's what the Merck manual does. So the Merck manual is basically disorders, issues, diseases, patho stuff. That's kind of everything you need for nursing school in here. In this bad boy. Signs and symptoms, things that you're going to want to assess for. It's more medically based rather than nursing based, so just be aware of that. But medical interventions, things like that. This is it's a much deeper dive than resources like this, like the Made Incredibly Easy series. So it's going to dive into more like the chemical level, the cellular level of things, the patho and stuff. Whereas these, like pathophysiology made incredibly easy is going to be more of a higher level overview. And it's important for you to know both. But I recommend that you start with a higher level one and then go deeper if you need to. So the Merck manual is divided up based on like that was stroke. You know, it's divided up based on problem. Now, it is a physical book. I have the physical book. I had it in nursing school. They do have an online version, which I actually prefer. I think it's better. Not that it's better, but it's just easier, right? Anything online. Some things I really like to have, like the Davis Drug Guide, I like to have physically. But for the Merck manual, I like it better online. Now, when you go online, Merck manual, you can just Google it. When you go online, there's two versions. There's a consumer version, which is like patients, and then there's a professional version. You want the professional version. So just tip there for you. Make sure that like at the top, it'll say you're reading the consumer version, switch to professional version, and you want the professional version because it'll walk you through more of like the medical stuff, how to, all the things. So those are the two resources I recommend. High level overview, like the Made Incredibly Easy series, and then a deeper dive like the Merck manual. That is that. So the Merck manual, how to use it was the question, right? How do you use the Merck manual? I would, whatever you're studying in nursing school, you can just like Google and like put like Merck manual, like stroke, Merck manual, heart failure, Merck manual, what have you. And then it'll pop up and it'll give you a bunch of information there. So honestly, super easy. That's how I'd use it. It's really helpful if you're doing like research papers or pretty much anything. Like if you have to do like a research paper on pathophysiology or, even a care plan or something for a patient, you need to understand what's happening with them first, pathophysiology wise, right? And then you can fix the problem. So it can help you in both those aspects.
Okay, so it is really it's a giant book. So it is really more in depth based on which is different than those Made Easy.
Yep,
books.
absolutely.
All right, so you'll need or you'd recommend both?
I recommend having both.
Okay.
I recommend having both. Now, if you are a Nursing SOS member, we do those two things for you. So we give you high level overview. You guys know me. If you've watched our YouTube channel, if you are in the membership community, if you've been around for a while, you know how I teach, you know how we teach, and we teach it to you step by step. And so we do kind of both. We do high level overviews and then we do deeper dives, what you need to know for nursing school. So we kind of hit both. If you are a Nursing SOS member, you have access to all those videos inside the membership community. So you don't really need those things. We do it for you. So there's that. Pretty cool.
Awesome. All right. And like you said, there is a online version of the Merck. Okay.
Of the
Merck manual.
Can we just call it the Merck?
I keep getting confused because there's no, that's up north. There's a building in my downtown that was like the Merck building. So
really?
So I keep getting confused, but
Merck manual.
Yeah, Merck
the
manual.
Merck. We should call it the Merck.
The Merck building.
The Merck.
So
there you go.
All right, great. That is awesome. Charlotte. Charlotte. I love this question. How do you deal with post-exam emotions?
Oh, good
when
one.
Talking through questions with peers?
Oh man, I didn't read your question, Charlotte, until Matthew just read it. And when he was reading the question, how to deal with post-exam emotions, the first thing going through my mind is don't talk to people. But then you added when talking with peers. So my number one tip for you is don't talk to people.
That's my tip as an introvert. Just don't talk to anyone.
Don't talk to people. So, okay. Here's kind of the thing. There's no point, right? There's no point in talking to other people other than the emotional aspect, right? What is the benefit to you? Let's think about this, friends. What is the benefit to you talking to students after an exam? They're either going to tell you got those questions wrong, or they're going to tell you got them right. And you're really hoping that you can compare your answers to your peers and validate that you got those answers right. Or you're comparing your grade to other people trying to make yourself feel better. right? So it's all emotional. Like there's nothing like actually tangible, beneficial to your grade about talking to peers, right? Now, this is different from an instructor, though. Well, we always recommend, Charlotte, I know you've heard me say this about 1,000 times. Always, always, always talk to your instructor after your exam. Whether you got a 98 on your exam, whether you got a 68 on your exam, talk to your instructors after your exam. Walk through the questions, item by item, question by question. Make sure you know why exactly you got questions right and why you got questions wrong. So, so important, whether or not you got a 58 on an exam or a 98, like I said. So make sure that anytime you are talking to your instructor, now, like I said, you probably should stay away from your peers. Another one of my tips that I talk about a lot is when you are going in to take a nursing school exam, like in class, in person, I would highly recommend showing up on time, right on time, or slightly late. For that exact reason, you don't want the emotion of the room to get you worked up. Like you guys know, you taking a nursing school exam in class, like in person, you go, and everyone's like, you could just, what do they say? Like you can cut it with a knife, like the tension, the air of the room, right? Like it is very hyped up, very anxious, very stressed oftentimes. And you just don't want that before an exam. Right? So when you're going to take your nursing school exam, show up right on time or slightly late so that you don't get worked up.
Yeah.
That makes sense.
I like that. First this, and then we'll circle back. There was a comment that I wanted to make too about just talking to your peers, because the introvert that I am, yeah, I like that answer of not talking to your peers, but more on that in a little bit. I can't read that name. Sorry. Talking about going to talk to your professor. This person just said that my professor doesn't do that, and that's okay. Just reach out and communicate that you do want to talk through your exam with them to learn more, be open about it. And really the side effect of that is that your professor now knows that you want to learn and that you're open to learning and you're open to doing the work. So that's a little side effect, even if they don't allow you to do that or they don't do that. Also, you might not know, maybe it's not standard that they do that, but you won't know unless you try. If you tried, then great. And if they still don't do that, that's still fine. There are other things that you can do to help review your finals. But as far as talking with people, really the best person to talk to about your exam is your teacher, because they're the ones that can actually give you feedback on what you're doing and what's the best way to change things around for the next time. Absolutely. So going back to talking with peers, I totally get that. And that happens a lot, right? Like right after you finish your exam and you leave your room. Hey, what did you get on number 13? Or what did you get on number 10? Or, oh man, that one question was really hard. What did you get? And just, it's kind of a bonding experience. And it is a kind of validation. Okay, I did this. What did you do? And I think the key thing to remember, what Christina was talking about, is both before and after exam, is what do you have that's in your control? And that's, we talk a lot about mindset. We talk a lot about just being in control of what you're in control of and recognizing the difference. So what are you in control of? As soon as you leave that exam room, all of your answers, that's it for your answers. So you do not have any control over that. And you can feel bad or you can feel good about that. But we've talked about this before. Those feelings are your own. And you can choose to feel however you want to feel. So talking with peers, I don't know. How does it make you feel? Does it make you feel, oh, I got all these wrong? Or does it make you feel validated? And is that helpful? I don't know if that is helpful or not. But the ultimate thing to remember is what is in your control. And once you leave that exam room, just leave it all there. As long as you tried your best, as long as you studied your best. And that's really the key thing, is being honest with yourself. Did you do everything you could do? Did you do 100% of what you could do and left it all on the table and left? Because at that point in time, no matter how you did, at least you are confident with yourself that, you know what, I did my best. I tried my hardest. Whatever the outcome, I'll learn from it. and I'll put those into effect for the next exam.
Absolutely.
But just talking to people, just to talk to people or just to feel validated, it might feel good, but is it actually helpful?
Right.
And that's something to just really dive into. And a lot of it is just mindset, and a lot of that is knowing what you can control and what you can't, and putting all of it on the table during your exam, so you can walk out of the room and say, you know what, I did it. I did my best, without feeling that doubt of, oh, if I would have studied for an extra hour, would I have changed my answer? No, just put 100% of your effort in at the beginning, and you leave it all there. And when you walk out, that's it.
My Brooke
Mhm.
Castillo, my life coach, she has this phrase: have your own back. Have your own back. Whatever happened in the past, have your own back with that. Decisions you made, things you did, what have you, it's in the past. You can't change it. But have your own back. You can change how you feel about yourself moving forward. So if you take an exam and you, like Matthew said, leave it all on the table, leave it all on the court, study your best, do your best. And then afterwards, have your own back with that. Realize I did my best. I tried my best. I'm going to learn from it, exactly like Matthew said, and move on. But have your own back. I love that. Now, I wanted to mention one other thing. Dane Tulu, am I saying that right? Dane Tulu on Instagram. My professor doesn't do that. So that's what we were just saying. If your professor doesn't allow you to go through your exam item by item or question by question after your exam, that's fine. What I want you to go through, I'm not entirely sure exactly what that means. My professor doesn't do that. Do what? What does your professor not do? Do they not meet with you at all? Do they not respond to your emails, or do they not set meetings with you? Like, what don't they do? If you can clarify that, because what I would want you to do, even if they don't allow you to go through your exams question by question after you take your exams, what I want you to do is write out your entire study process. How do you study? Step by step, write it all out. Take that to them and show them, okay, here's how I'm studying. What do you see that you would change? Is there anything that I am doing that you would recommend that I change, that I can do better? And another great question that we've talked about a lot is that you can ask your instructor, if you were taking your class, how would you study? If you were taking, so you're asking this of your instructor, right? So if Matthew's my instructor, I say, if you're taking your class, if you're in this class, how would you study? It's a great question to ask. So that's what I would really recommend. I know that some schools don't allow you to go through your questions afterwards, including if you're like a ATI or HASI program, oftentimes they won't. But if, some schools will. So always ask. And then even if they don't, it's totally fine. Just go through your study process with them. Exactly like Matthew said, it shows them that you care. It shows them that you're not going to give up, that you want to be there.
Mm-hmm.
There you go.
Yeah. Moving on a little bit to Shell, this is kind of an extension of that, but going past that on how you actually did in your exam. So Shell, please give me some advice on how to move on, because I failed, and not just an exam, the NCLEX RN for the first time. I gave all my effort into it, but I think I struggle with strategies. I'm 11 years out of school plus full-time mom with 2 kids. So congratulations on getting through that, and with all that's on your plate. And it's an amazing thing that you did to go through that. And yeah, your question now, what happens now? How to move on because I failed. That was on YouTube.
Is that on YouTube today, or was that from before?
Nope,
okay, Shell. YouTube. Okay, Shell, are you on? I have a couple of follow-up questions that's going to kind of drive my answer for you. Did you just take the NCLEX? Did you graduate school and now it's been 11 years and now you're just taking the NCLEX and failed it? Or did you take the NCLEX 11 years ago and fail it and not try again? Tell me which camp you fall into, or if it's something different. I need some clarification because that's going to drive my answer to you. Dane, sorry, I am not going to get this Instagram handle. They don't go through the exam questions by question, or they don't go through go through the exam question by question. That's totally fine. If your instructor doesn't go through your exam question by question, totally fine. Just like I said, go through your study process with them.
Yeah. So you want to dig into the strategies, and hopefully they can give you some insight on strategies on how you're studying and what to study and what not to study as well. So
yep, absolutely.
Yeah.
Shell, if you can just clarify that question, we're going to move on and then I will come back.
Yeah, definitely.
To that about talking about what happens. What do you do if you fail the NCLEX? And actually, let's talk about just real quick. What happens if you fail an exam?
Yeah.
Which is exactly what we were just talking about. You want to meet with your instructor right away. Walk through your study process with them. Go through the exam item by item or question by question. If they allow it, if they don't, it's totally fine. Now, one thing that I really don't want you to fall into is this pattern of I failed, or I didn't do as well as I wanted to, or I didn't do as well as I thought I could have, or, was going to. And then you kind of find yourself in this spiral of negativity and, I can't do it and it's too hard and all these things, right? Like all the thoughts that go through our brain if we don't meet our own expectations. If you don't meet your own expectations, what happens? Oftentimes you start to doubt yourself, right? And then if you start to doubt yourself, then you're not going to study as well for the next exam. And then if you don't study as well for the next exam, it's going to happen. The same thing. You're not going to do as well on the next exam. So it's like this self-fulfilling prophecy. It's really sabotaging your own success because you don't do well on an exam and then you start to doubt your ability. You doubt yourself, so you don't study, and then you don't do as well on the next exam. It's like this downward spiral, So what's most important for you to do if you find yourself in that position is to, first off, notice it. You have to notice it. We talked about this on, what day is this? Today's Wednesday. We talked about this on Monday, where you have to notice what you are doing. You have to notice what you are thinking. And then once you notice it, you can change it. Like I said, I noticed recently with me just over the past, I would say about few weeks, that I have been noticing in myself when I get anxious or stressed, I eat. And that was not something that I noticed in myself before a month ago. I never noticed that before. Wait, I am feeling stressed, I'm feeling anxious. And then I go eat something. That was kind of my release. And I didn't notice that. I didn't notice that was happening, so I couldn't change it. But now that I noticed that, I am now actively working on changing that. I am actively working on changing that because I noticed it, but you can't change something you don't notice. So friends, we've got a lot of people saying that, yes, you're in that same position. That's exactly what's happening to you right now. You didn't do well on an exam. You're doubting yourself, so you're not studying. If you find yourself there, like really do an honest self-assessment and see if that's you, if that's what you're falling into now, but you have to notice it first and then you can change it. So then you can start noticing those thoughts, right? Notice when you feel doubtful, notice when you think you're going to fail, or, any thoughts that you have that are driving you to not study, and flip the script. What is telling you that you can't pass your exam? What is it? Like, why don't you believe that you can? I believe that you can. So why don't you? And another kind of thought experiment that I really love and have taught a lot on, using myself as an example, if you have your exam coming up, which you do, so your next exam, if you are doubting your ability to do it, I want you to ask yourself, one of your peers, would you doubt one of your peers' ability to do that exam and to pass that exam? And if the answer is no, then why are you doubting yourself? If you would be totally confident in one of your friends passing your next exam, one of your peers in your class passing the next exam, if you're totally confident in their ability, why are you not confident in your ability to do it, right? Would you be confident in my ability to pass your exam? I would. So why wouldn't you be confident in your ability to pass your exam? Kind of a fun thought experiment. It's very easy to believe that other people are capable of more than we are. Such a lie. Friends, you are capable of so much more than you realize. You have got this. You have got this. Do not give up on yourself. It is so worth it to fight through this. It is so, so worth it. You just got to do it. You just got to do it and keep going and don't quit. But make no mistake, if you don't study for your next exam, that is quitting on yourself. So don't quit on yourself. Don't do it. Anything to add?
Yeah, I just think, what we were talking about a little earlier is just put everything out there. Put 100% of your effort on the table. Do all of the work. Be confident that you did do everything that you could do. Yeah. So no matter what happens, you feel confident that I did my best. You don't have that lingering feeling of, oh, if I just did this or if I just did that. But if you just go 100%, then you know, okay, I did 100%. What else can we tweak here and there? But it has nothing to do with something that you did not do. You just did 100%. So I think that's all great. And do not give up. Shell got back. She said, I took it last September 30th, 2020. You then did message and then retract it. Are you part of our membership community? Because that has some resources there, and we can kind of go through some general things right now. But I know we're kind of live and might have additional questions that will help flesh it out. So maybe also reach out on our tutor form with additional details as well,
email
us
if you have any questions,
so that we can get your answer more in depth.
So it sounds like Shell, you took so this goes back to the question. If you're just joining us, Shell had a question a few minutes ago. Please give me some advice on how to move on because I failed the NCLEX RN for the first time. I gave it all my effort and I think I struggle with strategies. I'm 11 years out of school plus a full-time mom with 2 kids. And then I just needed a little clarification. She said she took it last September. So totally fine. It really actually goes back to what we've been talking about a lot. So you just took it this last September. So Shell, for you, it sounds like you've been out of school for 11 years. Full-time mom, 2 kids. That's awesome. First off, that's awesome. It's a lot to do in 11 years, right? I've got 2 kids. I know. Trust me. I really don't want you to think that you can't do this because you can. If you took the NCLEX, I want to know, like I said, a little more information. Did you take an NCLEX prep program? What resources did you use? All of those things. I would look into an NCLEX prep program. Something like Kaplan, I believe, has one. The Hearst Review, I've heard, is really good. We have a local one that is super great. Depending on where you live, you can look up, local nurses that might teach a NCLEX program to help you. Things like that. If you've been out of school for 11 years, I would highly recommend that you take an NCLEX prep program. I would highly recommend that. So
awesome. If you have any more questions, definitely email us and okay. Shell.
Sweet.
October to December 29, enrolled in nursing SOS. Hooray!
Perfect.
Study for the NCLEX.
So submit tutor form because you're in the membership community. Submit a tutor form. Walk through with us what you're struggling with and let us help you. Okay? Let us help you with that. I was also going to say something else about the NCLEX. Oh, yes, right. If you, not you, Shell, anybody else, if you have not taken the NCLEX yet and you're like just graduating nursing school and taking it, let's see, I took the NCLEX, I think I was 13 So, man, it was a few months after I graduated. I took it. I think I was 10 weeks postpartum. So like 12 weeks. Do the math. 12 weeks after nursing school. I had the baby right after nursing school. Then I think I was 10 weeks postpartum when I took the NCLEX. And so if that's you, if you're going to take the NCLEX right after school, I would not necessarily recommend an NCLEX prep program for you, because NCLEX prep is kind of what you do all through nursing school. I honestly wouldn't worry about it too much. That's just me. But if you want to, that's totally fine. But, that's kind of what you do all through nursing school.
Mm-hmm.
But if you're struggling and really want the help and just like to know that you're going to pass, an NCLEX prep program would help. Here you go.
Awesome. For those just joining, welcome to the Nursing School Show.
I'm Christina.
We are talking nursing school topics. Ask us anything about nursing. I am Matthew. I will not be answering the nursing related questions. That would be Christina, because she's a nurse. But yeah, we've gotten some really great questions so far, and we will go through more. Angela, a little earlier, asked, I just can't read for the life of me. Is there any way I can pull the important stuff out, and how? I'm online. This is my first semester and I hate nursing so far. I feel like my professors are not teaching and they're not very helpful. Help.
Angelina, why do you hate nursing? I'm just super curious. What is it about nursing that you do not like? Tell me, Angelina. I'm going to latch onto that because I don't know. I mean, I don't know if I can help you if you really hate nursing and just don't want to do it. There are people who don't want to be a nurse. I have known several students that went to nursing school who decided for a semester that's not for them. And there's nothing wrong with that. There's nothing wrong with that. I think it's great. Nursing is not for everybody. So let me know. Do you hate nursing because you genuinely hate nursing and don't want to do it? Or, are you just in nursing school because everyone told you to go to nursing school and you listened, I don't know. Or are you in here and it just kind of stinks right now and you love it? You really love it, but it just kind of stinks.
Mm-hmm.
So tell us, give us a little clarification.
Is it just that? And something that we talk about a lot is, again, mindset, knowing yourself, know thyself. And yeah, is it really, is that feeling just a feeling in the moment? Are you just frustrated with what you said later, that your professors are not teaching, or you feel like they're not teaching and you feel like they're not being helpful? So are those struggles really frustrating to you and you're just like throwing up your hands? So is it that, or is it some really deep other reason that like, you know what, I really didn't want to do this, but my parents made me, or you know what, everyone says to do this, so I'm going to do it. What is going on behind the scenes there? So I just like to really dive into that a little bit more. All right.
Alrighty. So we've got Facebook questions that Aaron, I know you've been popping in here. Sorry, you guys on Facebook. It's kind of hard to read. So I don't know if you're
what do you want
the Facebook questions. I don't know.
Yeah, they're here.
Aaron, you just said just keep swimming. That is my motto.
What did you want to?
Well, I don't know. I just haven't been. They're kind of hard to read.
I've been capturing them.
Sweet.
Okay. All right.
Let's do it.
Let me see. So did you want to talk about this one?
Let's do a study. I want to keep jamming on the study tips. The reading is more general. Some questions are very specific. For example, procedural. What should the nurse do next? So that's a priority question. Anything that any nursing exam question that has, what's your initial action? What's your first action? That's a priority question. We call it a priority question, priority nursing action question. You might hear it called priority question. So you need to do three things. Keep three things in mind. The first one is the ABCs: airway, breathing, and circulation. Airway, breathing, and circulation. Your patient's airway must be clear, they must be breathing, and their blood must be circulating. If one of those three things isn't happening, that's a problem, right? Second, Maslow's hierarchy of needs. So we start with physiological needs first, which is like airway, breathing, circulation. It's kind of the ABCs, kind of the same thing. ABC, airway, breathing, circulation. And then the next one in Maslow's hierarchy is like safety needs, and you get love and belonging needs, and self-esteem and self-actualization needs. So it goes up the tier, it goes up the hierarchy. So you have to make sure to solve the foundational ones first. So if you are presented with a nursing priority action question, like what would you do first? What is the nurse's initial response? Those things. Make sure that you are making sure that their airway is clear, they are breathing, their blood is circulating. And then, so ABC's Maslow's hierarchy of needs, like I said, those physiological needs first, and then the nursing process. And the nursing process is ADPI or AD-OPI, assessment, diagnosis, outcome identification, if your school uses the O, outcome identification, planning, implementation, and evaluation. So what you're going to want to latch on with this is that assessment always comes first. Always assess your patient first, and then you can move on to the other steps. Always assess your patient first. Got to plan their diagnosis, nursing diagnosis, goals, implement it, evaluate, which is basically another assessment. There you go. Does that make sense? And now priority nursing questions. We have several videos on that. Let's see, pulling them out of my mind. Go to YouTube, Nursing SOS. Go to YouTube, search Nursing SOS ABC, search Nursing SOS ADPI, search Nursing SOS Maslow's hierarchy, because we have all three of those. And then in the membership community, we have a whole video on priority nursing action in the fundamentals course. Mm-hmm. So if you're a Nursing SOS member, any of you guys out there, Nursing SOS member, check that out.
Awesome.
Did I miss anything?
Nope.
Okay.
All right. So I'm just going to read, Chelsea, your comment verbatim, and then we can dive into it a little bit, just because it's long and it's on Facebook and I can read it. Hey, guys. So last time I hopped on here, you really got me changing my mentality and approaching my program with a positive, I will do this mindset. I study and applying myself so much and go into it so positively. I change my answers despite my intuition, and it's so frustrating. So I'm assuming like in exams and things. I have 3 exams tomorrow, and it's sink or swim. Looks like either Nicole or Marilyn is on either.
Hello, Nicole or Marilyn.
I don't know. Maybe just some study advice. I spend an unhealthy amount of time studying, like 8 to 10 hours a day. No joke.
Okay. So Chelsea, it sounds like you're, for all of you, if you find yourself studying all day, every day, all day, every day, there is something wrong. You do not need to be studying all day, every day in nursing school. That is not effective. You need to have a break. You need time to process. You need to eat. You need to sleep. You need to take care of yourself. So if you find yourself running yourself to the ground, studying, reading a textbook all day, every day, there is something wrong. Not wrong. I mean, nothing wrong with you, just wrong with how you're studying. It could be better. So, underneath all my textbooks, the nursing school study system walks you through step-by-step how to study in nursing school. There you go. NursingSchoolOfSuccess.com/study system. And so when you learn how to study and focus on studying the right things, what happens is you start spending focused study time. And when I say focus, I really mean focused. Focused study time, studying the right things, and you will do better on your exam and you will have more free time. Rather than what often happens, what a lot of us do, is that we just try to study everything. We try to learn everything for our exam. We dilute what we're learning. We try to know everything before the exam, and we end up knowing a little bit about a lot of things, but not enough about the things that they actually test you on, right? So if you try to read every single thing in the book, it's not going to work very well for you. Follow the tips, follow the steps in this study system. You will do a lot better on your exam. So high level, here's how we do it. Make sure that you are studying the things that your professors talk about in class. Read the sections of the book that your professors talk about in class. Whether it's in class in person or in class online, what have you, PowerPoints, modules, outlines, lectures, those things. Make sure you're focusing on studying those things that your professors talk about in class. And then above that, 4 main things that you're going to focus on. 4 main things. Pathophysiology or physiology, signs and symptoms, nursing assessment or nursing interventions. 4 things. Patho, signs and symptoms, nursing assessment, and nursing interventions. Those are the 4 key things you have to know for nursing school, whether it's about fluid and electrolytes, whether it's a med-surg disorder, whether it's OB disorders, pediatric disorders. Those are the 4 things that you have to know. Pathophysiology, signs and symptoms. So what's the patho? What's the underlying problem? What are we trying to solve? What are the signs and symptoms that the patient might present with? What's the nursing assessment? What are you going to assess for? What are the nursing interventions that you're going to do to help fix it? 4 things. Patho, signs and symptoms, nursing assessment, and nursing interventions. We walk you through that step by step in the nursing school study system. So nursingschoolofsuccess.com/study system. Boom. Sweet.
So
I hope that was helpful.
Just a follow-up. She was just saying, I watch all your videos. They're so helpful.
Yay.
I just worry about retaining the information.
Mm-hmm.
So I think that just goes into practice, and really a lot of it is the general strategies and learning to critically think. Because once you have the strategies in place and in critical thinking in place, no matter what the situation, you can kind of adjust your thinking to a specific situation, and basically delve through the strategies that way instead of having to just do rote memorization for every single little thing. So that's something that you just want to get at, is beyond the rote memorization into critically thinking about nursing topics in general, using that framework. So using the framework out and then diving into it that way. Overstudying is definitely a thing, and definitely you need rest and sleep to process things and move things from your short memory into your long-term memory. So all that worrying and stress and overstudying and not sleeping enough, that does have an effect on your studying as well. So just want to be on the lookout for that.
For sure. And if you're finding yourself not being able to retain the information, like you said, that really tells me that you are not being as efficient studying as I would like you to be, and as you probably want to be. Because if you're not retaining the information, that tells me that you're not actually learning it. You might just be reading for the sake of reading, right? You might just be studying for the sake of studying, reading words on a page, but not actually applying it or thinking about it or actually learning it. Because if you can't remember it, you're probably just reading for the sake of reading, which is not efficient, right?
So this has popped up in our membership community private Facebook group a lot. That I noticed just when scrolling through. And Chelsea, you've mentioned this a couple times, and I don't think we've ever really talked about it or what your opinion is on it, because I have an opinion, and I think it is more opinion based, but I'm curious. I'm curious what your thoughts are on this. When you go to an exam, the first answer you put, and then you go back through and review and changing your answers. There's been some lively discussion on whether to stick with your first answer or if it's second guessing and you change it and then you find out that you got it wrong. So I'm curious what your opinion is on that. Chelsea, I know that you brought it up, and there's a lot of people on our membership site and a couple more people on here that are in membership site. Hello. Do you guys have any opinion on this? When you're taking an exam, do you stick with your first answer and just not review it? Do you go back and review it and change it, second guess yourself? Or do you feel bad when you do change it and get it wrong? All those things that come together. So
tell us in the chat, do you change your answers or not?
Yes.
Tell us in the chat. Okay, So here's my opinion, which is by no means the, anything to write home about, really, or to, do or apply to your own life. But my opinion is that this could go a couple of ways. And I feel like if we were actually to examine nursing school exams, the initial questions as you put, and then if you go back and change the answers, I would honestly venture to guess that a lot of the ones you changed are correct.
And then you change it to wrong to be wrong, or what?
That the ones that you changed, a lot of them, you may have changed them to the right answer, but then some of them, perhaps a lot, you may have changed to the wrong answer. So I would almost venture to guess that we oftentimes think about and ruminate on the ones that were correct, but we changed to the wrong answer, and we disregard the ones that were wrong, and we changed to the correct one. Is that what you were going to say? I feel like that's kind of what you were going to say.
That's what I was thinking, along with a couple other things.
We're usually on the same page about things. We're basically the same brain.
So Barbara, you're saying, Oive, never change your answers. And I think that comes a lot out of that. We tend to stick... What sticks in our mind is the negative things, right? So a lot of the things, I failed this exam. You don't remember that you passed all the exams up until now. So, all right. But you tend to think and ruminate on those negative things. And so let's say you have an exam that has however many 20 questions, and you change 10 of them. 5 you change to the right answer, and 5 you change to the wrong answer. You're going to remember the ones that you changed to the wrong answer, not the ones that you changed to the right answer.
Right.
So whether it all comes out in a wash and it's actually equal, I don't know. I think it kind of depends also. I think it's a very individual thing too. So it's not something that we have a very clear-cut answer, never change your answer, or always change your answer, because
no one says that.
Yeah, no one says that. No one says, okay, answer all the questions, then go back and change all of them. No one says that. So it's kind of weird, that our thought process on that, but it's a very individualized thing, because I know myself, there's that gut feeling. People have this gut feeling, and that's what they also associate with the very first answer is usually my right answer. It could be right, it could be wrong. It depends on a bunch of things, but I'm a gut feeler, so I've always thought that I should not change my answers, but I do know when I do change my answers, I do it for a very specific reason. So, but it is for yourself too. If you're spending like all of your time really reviewing a question and making sure that the first time you make it your answer, that's your answer, then fine. I know other people that kind of read through all the questions first, if they can, and just kind of say, this is what I think it is, and then go through it all, and then go through it again. And obviously, if you go through there, you might be changing things if you're not fully thinking, if you're not reading the whole question, if you're just kind of skimming, then chances are likely that you'll change your answer that way. So it just depends on how you take a test, what's available to you. Someone on YouTube said that I can't even change my answers on the computer. So sometimes that's not even an option for you. So a lot of these things play together. But as far as the underlying question, never change your answers, or go ahead and change your answers, I think it is almost down to personal preference. And just remember that we do stick that those negative answers, the ones that we get wrong, do really stick out to you.
So I'd be curious, the next time you take an exam, let us know. Did you find yourself changing answers? But also keep in mind what answers you changed. And I want you to think about the answers that you changed that ended up being correct. Like that ended up being like the one that you changed it to, the answer you changed it to is now correct when it was originally wrong, and you changed your answer to the correct one. Because I bet that happens.
I bet that does.
For me, I that was often me. So I did have the experience of when I would change an answer and then it ended up being, correct the first time, and then I changed it to the wrong one. I did have that experience, but for me, I'm, just being really careful. Like, no, I'm still gonna go with this answer, or no, I'm pretty sure, now that I've kind of had time to process it and sit here and Because when you get to a nursing school exam, you sit down to take it, you are like hyped up. I mean, sometimes you can get, it's like, it takes you a little while to come off that.
That's true.
So like 5 or 10 minutes, you sit down to take your exam. Give yourself 5-10 minutes, keep answering questions, but it might take a few minutes for you to kind of, calm down and kind of settle into the exam. And then for me, that's when I would, go back, look at, the first 10 questions that I answered, make sure that I'm still cool with those answers, because you kind of know you're kind of more emotional when you sit down to take an exam for that first, 10-ish minutes. I could see it going both ways for sure. Yeah. Charlotte, something that I also wanted to mention that I completely forgot to mention when we were talking about it is when, Charlotte, your question, does anyone else have the same issue that you don't remember the question?
All the time.
After you finish an exam. So if you don't remember the questions, yeah. So totally have that problem because you're like brain wiped, right? Like your brain is totally toast, after an exam, like you're just beat. So, but something that I wanted to mention earlier that I did not, make sure that you check with your school's policy about talking about exam questions with your peers. From our school, we were not allowed to. So I would venture to guess that for a lot of schools out there, you're not allowed to talk about the exam questions. You're not allowed to write them down. It makes sense. You don't want to cheat, right? So just know your school's policy around that. Before, you don't want to like go comparing questions and stuff with your peers if it's not allowed. So just that.
Okay.
Little disclaimer there.
Yeah. So I think it really is independent. So I think whatever you do, all the studying that you did up until that point will help you get the answers. So again, it goes back to what we've been talking about all today, is just put 100% of your effort in, and just do your best.
Have your own back.
Yep.
Have your own back about it.
So.
For sure. A lot of people are saying always stick with the first answer.
A lot of people say that. I hear that a lot.
I do too. And I'm not sure I agree with it.
I'm not sure if I agree with it. Just to throw a wrench into things, if people have some spare time for spare reading, you can go ahead and read Blink by Malcolm Gladwell. We've just been talking about that book. Really good book. But it talks about, the specific example it talks about is baseball, and a professional baseball player, or even not a professional baseball player. When someone pitches you a ball and the batter hits the ball, from an outside perspective, that's all you see is the ball getting thrown and the batter hitting it. But what you don't see is all the little micro things that go on between the split second. I mean, that ball is coming at him at 100 plus miles per hour. All the little micro decisions that he makes that happen on the fly automatically because of all the practice, because of all, lack of a better term, all the studying he did. He doesn't think about it, that he needs to put his bat exactly at this angle and hit exactly this way in order to hit the ball. It just all comes together. And that comes from all of the studying and preparation that he did before up until that point. It's the kind of same thing with nursing school and studying in general. That's what we want to get it to, that kind of second nature feeling for you. And you won't get that first exam, second exam. You might not even get to it until beyond nursing school at some points in time. Yeah. But that's really what you want to get to, is that really it's happening like that because it is so second nature to you that you're not really thinking about why you did something, but you just know it's the right thing to do because it's so ingrained. And sometimes that's where people have that idea of a gut feeling. And that's really what the technical thing is about the gut feeling, is it's everything unconscious that is coming together and saying, this is my gut feeling. I don't know why, but this is the answer. The problem with that is through nursing school, and if you don't have that ingrained full study and really ingrained in that, like a professional baseball player, your gut may be wrong. You might have a gut feeling that is not right. So that's something to be aware of when you're just relying totally on your gut.
That makes sense, and not having the background to back it up.
So
make sure that when you're studying that you're actually spending time, not just reading the textbook, but applying the information.
Yeah, that's what we talk about, critical thinking.
Yeah.
Beyond the textbooks and beyond that is
connect the dots between things.
Yeah.
Make sure that you are connecting the dots. Now, critical thinking, we do have a free critical thinking cheat sheet for you. NursingSchoolOfSuccess.com/critical thinking.
Yeah.
NursingSchoolOfSuccess.com/critical thinking. There you go. A lot of students are saying, and my school was the same way, so I'll throw this out here. When you take an exam, you can't go back.
Mm-hmm.
So we had some exams that were that way. Those mimic the NCLEX more because on the NCLEX, you can't go back. If I remember right. I'm pretty sure. Can't go back. No, you can't go back on the NCLEX.
Mm-hmm.
Like I had to think back for a minute. No, you cannot go back on the NCLEX. So nursing schools will mimic that if you're in like a HESI, ATI program, what have you. Most likely, they're not going to let you. It's like one question at a time. When you click, that next button is gone. You can't go back. So, things like that. You just have to do your best. Like there's no two ways around it, right?
Mm-hmm.
Don't beat yourself up. Is that going to help you? No. If you beat yourself up after your exam and tell yourself, ugh, I stink at life. I'm a failure. I'm never going to pass nursing school. Like that's not helpful for you, right? No. The answer is no. It's not helpful. Thank you, Barbara. Nope. Not helpful.
I think that's the quote of the day is have your own back.
Have your own back.
Have your own back.
Thank you, Brooke Castillo from the Life Coach School. There you go. I think that question's for you from Charlotte.
Oh, do you listen to Audible? If so, what books do you listen to? Yes, we have Audible, and yes, we do listen to a lot of books.
Yeah. We listen to a lot of books.
We do listen to a lot of books.
So speaking of Malcolm Gladwell, I just read David and Goliath by Malcolm Gladwell. So good. So good. My favorite books. I'm going through The Case for a Creator by Lee Strobel. That is one I'm currently reading. And then The Case for Christ. I read that book every year. I love that book. One of my top favorites. So those are the two most recent ones that I have read. So Case for Christ, Malcolm Gladwell's Case for Christ by Lee Strobel, Malcolm Gladwell's David and Goliath, and then Case for a Creator by Lee Strobel again. Malcolm Gladwell's David and Goliath is about underdogs and how underdogs in society find success and why being an underdog can actually help you be successful. So oftentimes we have this perception of people who are successful at things that they were born that way, or they have some extra talents or what have you that like made them successful. Whereas that book is saying like, no, that's actually not the case. And it's a great book. Mm-hmm. So I totally would recommend that if you are struggling in nursing school and not sure which way is up. I also, I don't know. I don't know if I would fully recommend this book, but I did read Can't Hurt Me about, I want to say 70% of the way through Can't Hurt Me. Do you remember me listening to that book? It's called Can't Hurt Me. It's by David Goggins.
Oh, yeah.
And I really loved it. But the thing is that there is a lot of curse words in that book. And I honestly I couldn't get through the full thing because I'm not around that. I don't know. It wasn't for me. Which is totally fine. It might be your favorite book ever. And I really loved the book. It's called Can't Hurt Me. He is a Navy SEAL. He's got like so many. It's his life story about coming from nothing, abusive home, like one of the worst stories of growing up, and then becoming, a Navy SEAL. Everything that he's achieved in life. It's incredible, like what he did. And it's super motivational, super inspiring. I would say it's one of my favorite stories. It was kind of hard to listen to for me personally. No, perfect. Yeah, your wife, the Can't Hurt Me, Charlotte. Yeah, it's so good. I really, or Case for Christ, tell me which one.
Yeah.
Yeah. But Case for Christ is great. Yeah, Barbara, I love that book. I listen to it every year. Yeah.
those are all kind of nonfiction, and we do read a lot of nonfiction books.
Yeah, those are all nonfiction.
Yeah,
I really like nonfiction.
there are a lot of ones that I've read too. A lot of self-improvement things like that.
We are very much in that space.
Yeah. I've mentioned Rory Vaden a lot. His Take the Stairs book is really really good. Procrastinate on Purpose, funny title, but that's another really good book. And then there's just a lot that we read. But also in addition to that, I know you guys are in nursing school. If you need to kind of get away from all the nonfiction, all the hard info books, fiction books are a good way of kind of relaxing and kind of just taking a step back from everything nonfiction. So I do listen to fantasy books. Probably our favorite author is Brandon Sanderson. All his sci-fi fiction books, fantasy books are really good.
I really liked. I haven't read a ton of his books, but Matthew showed me Skyward, which I really liked. Skyward and Starsight. Yeah. Starsight. Skyward is the first one, and then Starsight's the second one. Yeah. And then The Arithmetist I thought was really good. And that's more of a kid's book, isn't it? Yeah. Not kids book, but like youth, like teen. I love teenage fiction novels, to be honest, because they're more lighthearted, I think. I think they're more lighthearted.
I can see that.
You know, they tend to be, well, okay, I don't know what like teenage books there are in the world, but the ones that I read tend to be more wholesome than a lot of the adult books that you see around. So I like the teenage books. I think they're fun. Yeah. Like teenage romance novels. I love. I think it's great. All right.
So I think those are all very good. Perfect. Reading is a great way of spending some free time if you do have any free time. If you do not have Audible, check out your library, because a lot of our library has an app that you can download, and they even have audiobooks that you can borrow. So I've actually been doing a lot of that as well. So if you do not have Audible or need to find a book to listen to, go ahead and check that out too.
Not even books though. If you're in nursing school, if you really want to read a book, that's awesome. But 3 things that I would recommend for you. Really 3 things. The first one is the Daily Audio Bible, which I really like. Daily Audio Bible, it's just, one day, every day, 15 minutes, and you go through the Bible in a year. Daily Audio Bible. Check out Brooke Castillo's podcast. Brooke Castillo with the Life Coach School. Brooke Castillo, the Life Coach School podcast. Check it out. I cannot recommend that enough. So Daily Audio Bible podcast. Brooke Castillo with the Life Coach School podcast. Dave Ramsey podcast. Dave Ramsey, I listened a lot to that in nursing school. We've been listening for Dave Ramsey since I was a little kid. But I find him super motivational and kind of a kick in the butt. So there you go. I really found that very inspiring and motivational to get me through nursing school, even though it often has nothing to do with nursing school, but just like life in general, he talks about. So I really like Dave Ramsey and Brooke Castillo, obviously, because I talk about her all the time, but totally Brooke Castillo. Check it out. Check it out.
All right. Well, I think that is it for now. We've gotten a lot of questions that we were not able to go through, so I have them all here, and we will probably circle around, do a couple more AMAs sprinkled around in there with some other topics this coming week. Like Christina said, next week we'll be talking about finals. So if you have not yet, Mondays and Wednesdays, we have our lives. Go ahead. If you're on YouTube, subscribe, hit the bell so you are notified. Gabs, you had a question about how to get the most out of clinicals. Kayla had clinical questions, and Moonlight had a question about strategies for before you start nursing school. So those are definitely ones that I want to touch on. So we weren't able to get to those, but we will, along with a couple other ones for next week. So go ahead, subscribe, hit the bell if you have not. We have it Monday, Wednesdays, 9 a.m. Pacific, noon Eastern, et cetera, et cetera.
Yes.
Anything else?
Charlotte, I would love to start a podcast.
Food for thought.
That's food for thought.
Food for thought.
I like talking, so I don't see why not. But YouTube has kind of been our thing, because live video for me is just like my favorite thing of all time ever. So we'll see. Eventually I'll start a podcast.
We will see.
All right, friends.
All right.
We'll see you on Monday at 9 a.m. Pacific Standard Time, 12 p.m. Eastern. Have a fantastic rest of your week.
Take care.
Did Instagram not shut us off?
No, they did not. We'll have to take a look at that. Maybe we can go longer.
Did they give us longer time on Instagram?
I don't know.
Thank you, Instagram. Okay, shout out to Instagram. All right, friends.
All right, thank you.
We'll see you next Monday.
Bye.
Goodbye.